Welcome back to the Better Health Now podcast. Today, I actually have a familiar face back on the podcast, Dr. Gould, who was recently on the podcast a few months back. For those that maybe haven't seen that episode, would you like to introduce yourself and tell us a little bit about what you do here at Cullman Regional?
Sure. Thanks for having me back. This is an honor and a privilege. I've listened to my own podcast.
There you go.
I'm a big podcast guy, so it's kind of a treat. Again, I'm Steve Gould. I'm an orthopedic surgeon here at Cullman Regional Medical Center. I've been here for about 5 years now. I generally see and treat most orthopedic injuries and have a specific specialty training and interest in sports orthopedics. See and treat injuries with and without surgery. All age groups.
Yeah, and so today's conversation is primarily talking about sports medicine.
Yeah.
What exactly is sports medicine, and why do you think it has become such a prominent subspecialty in orthopedics?
Sure. Yeah. So sports medicine is the care and treatment of athletes, injuries, injury prevention, and then treatment of injuries after they happen. Certainly, treating all youth sports up through athletes coming out of college and even to the professional ranks. But then I think another way to think about it too is, we're all athletes in our own way. Life itself is a sport for all of us.
Yeah.
So even, working, jobs out in the real world, and then, time outside, doing things we enjoy, those are activities in sports that, unfortunately can lead to injuries. And so sports medicine actually kind of covers all of those sort of activity related injuries, both preventing them and then treating them when they happen.
Yeah. And so was your experience kind of being in sports, is that something that led you to kind of pursue sports medicine and kind of that orthopedic side of it?
Yeah, it was for sure. I grew up playing all different kinds of sports, and then in college I played lacrosse, and it was at a D1 school at Johns Hopkins in Baltimore, which was super exciting, wonderful opportunity, and sort of the combination of being interested in medicine and being around that level of sports and athletic competition. I myself, thankfully, was never really significantly injured to the point that I needed any kind of significant surgery or anything like that. But, tons of my teammates did. And I started even then kind of shadowing an orthopedic surgeon there who had also been a former lacrosse player. And that was definitely an inspiration for me to kind of pursue that, then going into medical school, residency training, and practice.
Yeah, and so that having that specialty in sports medicine and that training is something that is in addition to your normal schooling. Tell us about some of that training and how it kind of prepared you for today and the patients that you see.
Yeah. Medical training is a long, stepwise process. And then as we finish up our orthopedic surgical training, which is usually 5 years, there's an opportunity to do an extra year of fellowship training, a year or two. Sports medicine, sports orthopedics is the specialty year, basically fellowship that I did. And with a very well-known, the Andrews Sports Medicine Fellowship, which coming from the Northeast, I still very much knew Dr. James Andrews. And that's what brought me down to Birmingham and to Alabama. And so for that year, it was just a wonderful sort of indoctrination into really high-level sports medicine, taking care of athletes from multiple universities in the state, seeing patients treated in the clinic and in the operating room. Because of the level that a lot of athletes need to get back to, and the really specific kinds of treatments that we have for injuries, spending that extra year and then continuing to stay current and up to date on specific sports medicine related treatments really allows you to take care of athletes in I think as full and helpful a way as possible. And there's just, it's always growing too. We're always learning more things about it and ways to improve it. the care of athletes and patients. So it's really exciting.
And so, what is the typical or most common sports injury that you see?
Most of the time, it's sprains and strains, and that basically being injuries or inflammation around muscles and ligaments and tendons. So all our bones where they meet, those are our joints, and the joints are stabilized by ligaments. And when they get injured, basically, it's a sprain. And then, our muscles are what move those joints. And when they get injured, those are strains. So, far and away, strains and sprains are what we see a lot of. I would say, first line of treatment is always prevention. That's a big one. Okay. Getting out and doing any sort of activity, the more well prepared that you are going into it, and the more prepared your body is for it, the better off you're going to be. So, getting out and playing basketball, you don't want to just sort of put on brand new shoes and run out on the court and try to play a game right away. There's a lot of sort of physical conditioning and training and equipment and all sorts of things that we want people to be doing before they get out there. So, for kind of people my age who are sort of outside of the, school sports and it's a little bit more recreational. There's a lot of things that we, recommend doing just from an overall conditioning and preparation standpoint. I would always recommend to people, getting into things, just doing it gradually, so that your body not only gets a chance to sort of get used to it and kind of warm up into it, but you're also going to have the most fun possible, I think, when you feel confident and safe. We've talked to people in the community who are getting really into pickleball. Pickleball is sweeping the country, and it's wonderful, and it's a lot of fun, and it really does help. I think to be as prepared and conditioned as possible. So how do we do that? One thing that we do a lot of with our patients after we see them getting into new sports or trying to continue through activities with some of these sports injuries is get them, conditioning exercises, things that they can do on their own. And then physical therapy is a huge part of it too. And I'll make a plug for our physical therapy partners here at the hospital. I mean, they're great, and they get a lot of us, including myself, through injuries and recovery, and just also in overall better condition to be able to participate in sports and activities.
Yeah, and I think that conditioning, especially even as someone, 7, 8 years removed from high school, that the way you go into sports when you're a kid versus the way you go into sports when you're more of an adult, and the preparation involved with it, the more stretching. Hey, like I actually need to do a warm up. I can't just jump into it and hope I'm going to be okay because I'm 12 or 14 or whatever it is.
Yes.
With kids being really involved with sports and playing a lot of sports, what sort of advice do you have for parents whose children are in sports and trying to prevent these injuries and kind of treat these injuries early on?
Yeah. That's a great question. And I think it's been a really big focus of a lot of sports medicine physicians and doctors. So, going back to Dr. James Andrews, he helped pioneer an initiative basically with baseball and softball pitchers because of how often just increased stress and strain on throwers' shoulders were causing injuries, not only to the arm, the shoulder, and elbow. Basically adhering to recommended rest, okay, and pitch counts, and it's hard because there's more and more opportunities to play year round, not just in a rec season, but with travel ball, summer ball. It can really be nonstop and go year round, and it's fun. And it's a really great opportunity, but I think at the same time we need to be realistic in sort of the stress that is putting on our youth athletes' bodies, knowing that sometimes less is more. We see a lot of people, a lot of kids, a lot of people who come in as patients who sometimes really the best treatment that they're going to get is sort of a prescribed period of rest, a rest from pitching, a rest from a certain activity, not just to do nothing, but oftentimes to then get in with a good physical therapist or a good athletic trainer, and just to get sort of attention placed on other areas that need to also get some focus. So that's really an important thing. I think, trying to encourage multi-sport participation is a really helpful idea that I think we're sort of veering away from and maybe now going back to. There's a lot of obviously interest in playing sports at the highest level, potentially competing for a scholarship, and then getting into a college program to play sports, that you'll end up just devoting your whole life to one sport. But we know that in order to really be not just as sort of healthy and safe from an injury perspective as possible, but also really to be as competitive and as full an athlete as possible, it's really a good idea to be playing more than one sport. And I think you'll see that sort of across the board. A lot of our top athletic performers, they came up playing a whole lot of sports. And so not only is that going to be probably safer in a lot of ways to help prevent some of these overuse type injuries, but also it's probably at the end of the day just going to be more fun for the kids, for the athletes, for the parents, for everybody, to be able to sort of diversify that sports experience and sort of pick up skills, meet new people in the different sports and sort of help sort of offload some of the areas that are unfortunately getting a little too much athletic overuse.
Yeah, I think too, it's, that for the parents, if the longevity of their child playing a sport is something that they see in the horizon, figuring out ways in which to help with that longevity and kind of preserving them now. Because I mean, as someone who grew up playing a bunch of different sports, because I think that's what everyone kind of does, the knowing when is too much is often hard for a kid.
Oh yeah.
And so having that patient be like, or having that parent be like, hey, I know you could probably go for another 2 innings, but you should probably stop so that you're good for 2 days from now or whatever it might be. And knowing that the kid is probably not going to like to hear that, but in the long term, it'll be a bit more beneficial for them.
Yes, exactly.
As we're kind of wrapping up the conversation, is there anything else that you want people to know about sports medicine, sports injuries, anything like that?
Yeah, I would just say, whenever you're either dealing with an injury specifically, earlier evaluation, earlier treatment is going to be better. We kind of see, people who can come in pretty quickly and get treated. And then almost all the time, that's going to help us get them feeling better and back out quicker. Okay. Certainly, I think people try to tough things out, which is great. Pushing through some discomfort is okay. But at the same time, a lot of times it's something that can be helped and addressed, so that it doesn't become a more serious issue or sort of a lingering issue. So, making appointments to see a sports medicine specialist, making an appointment to see a physical therapist, a trainer. It's always a good idea to get things checked out. Best case scenario, it's something that just, feels better in a few days and we kind of send you on your way with maybe some ways to prevent it in the future. But also, kind of getting in early, helps things from getting worse and sort of the recovery just tends to be a little bit quicker.
Yeah. Well, I appreciate you being here today. I think I learned a lot about kind of the work you do and kind of ways to prevent it as people that are listening that are post their high school career or post college career, or maybe they have young kids they're trying to play with, making sure that they are able to be aware of their injuries, be aware of what their body's telling them, and come in if needed. We'll be sure to have everything in the episode notes for people to find links to anything that we've talked about, but I appreciate you being here today.
Oh yeah, man. This is a real treat. Thank you so much. I appreciate you.